Peace. Hi, it's Heart Love. Welcome to the YouTube live book reading of Clinical Application of Respiratory Care. We're in the 6th chapter, Oxygenation. This wonderful, wonderful read by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. We pick up page 129. Peace. Hi, it's Heart Love. Welcome, YouTube. Somehow we do. Masters are going to be master. Wish you all great Friday, masterful day. Gotta give thanks. Had a wonderful year healing session. And so, here we go. The cardiovascular response to hypoxemia. Top of page or middle of page 129. The most effective mechanism by which the body responds to hypoxemia is that of increasing cardiac output. It is important to understand that tissue demand for oxygen is constant over a given period of time. Thus, if the cardiac output increases while metabolic rate stays stable, the amount of oxygen extracted from any 100 milliliters of blood decreases. The effect of this is to increase the venous oxygen tension and its corresponding hemoglobin saturation. Of course, systemic AV shunting will produce the same result, but at the expense of tissue oxygenation. All right. Hypoxemia and oxygen therapy. Welcome, YouTube. Peace. Only hypoxemia caused by a decreased alveolar oxygen tension will respond dramatically to oxygen therapy. This should be obvious since the prime purpose of breathing and increase oxygen concentration is to increase the alveolar oxygen tension. It is essential to remember that ventilation perfusion mismatch will result in regional areas of decreased alveolar PO2s. This type of VQ inequality or perfusion in excess ventilation is responsive to oxygen therapy. Peace, peace. Hi, it's Heart Love. We are reading from Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Medical MCAT material for the people for free here on live on YouTube. You know, that's what we do as light workers. Give it to you. All right. The primary compensatory mechanisms for hypoxia caused by true physiologic shunting are either 1. An increase in cardiac output, 2. A decrease in the oxygen utilization, AV systemic shunting, or 3. A direct decrease in the amount of shunting by a change in the pulmonary distribution of perfusion. Top of page 130. Internal respiration. The volume of oxygen consumed by the body in 1 minute is defined as oxygen consumption, or VO2. Ding! Many factors determine the amount of oxygen to be consumed, such as temperature, stress, thyroid function, adverse biochemical effects of disease, and physical activity. At complete rest, the body is considered in a basal metabolic state, and the oxygen consumption per minute is known as the basal metabolic rate. The respiratory care practitioner must appreciate that there are numerous factors affecting oxygen consumption besides the demand of cells for oxygen. Obviously, the adequacy of transport of oxygen to the tissues is significant, along with the existence of an adequate oxygen pressure gradient between blood and tissue. It must be remembered that the microvascular system, capillaries, plays a great role in determining oxygen consumption. There is no way for oxygen to be consumed if the blood does not flow through the systemic capillaries. Therefore, internal respiration involves diffusion of oxygen into the cell and appropriate utilization of the oxygen. Very key, very key. Whew, that was respiration 130. Chapter 6, oxygenation. This is powerful, powerful. Live from the light here in LA. Thank you so much for reading books with us. Love to all the book lovers community. This is how we do. Masters are going to master. So I will keep doing reading the books because this is anatomy and mastery of thyself. So thank you so much for being here. Tissue hypoxia. Cellular energy is necessary to accomplish chemical reactions. Many essential biochemical reactions for sustaining life require a considerable amount of energy. In fact, such a high degree of energy that they have been referred to as thermodynamically improbable. This means that the energy required for many necessary biochemical cellular functions is so great that it is almost impossible to conceive that the cell can manufacture such energy. The cell obtains this great degree of energy from substances called high energy phosphate bonds. In respiratory care, we are primarily concerned with the high energy phosphate bond that is contained in an adenosine triphosphate, or ATP. This is very key. Ding! This is how energy stored reacts and what levels it releases. ATP. And it only happens, so big, major. The adenosine triphosphate, ATP. Most cellular energy is utilized, transported, and stored in the form of these high energy phosphate bonds. Breakdown of these bonds is accompanied by a tremendous energy release. Oxidative metabolism is the normal mechanism by which energy is stored and released from high energy phosphate bonds. The mitochondria are cellular constituents that contain all the components necessary to form and break down ATP. Molecular oxygen must be available in the cell in order for the biochemical process within the mitochondria, Krebs cycle, to produce high energy phosphate bonds and allow the release of energy for biochemical processes. When the delivery of oxygen to the mitochondria becomes impaired, the energy contained within the Krebs cycle can no longer be made available. The cellular oxygen tension at which the mitochondrial respiratory rate begins to decrease is called the critical oxygen tension. Various studies show that as long as other factors are normal, the mitochondria can function adequately when cellular oxygen tension is less than 5 millimeters Hg. At the present time, however, it is not possible to delineate critical oxygen tensions for various vital organ systems under various conditions. Peace, highest heart, love, everyone. Thank you so much for being here. I know. Thank you so much for the likes and subs. We're pushing towards 500 reading books in this peaceful corner of YouTube where we read books and learn from masters. I'm a master fitness trainer, Uriel Riley. Thank you so much for being here. This is critical information about mastering ourselves and how we make ourselves better, right? So learning about the VO2 max is about your oxidative levels. And what the oxygen does is it helps create the ATP. And this is built in the mitochondria. That's what we're talking about, the molecular oxygen. But it has to be available, right? So thank you so much for reading with us. We make the clinical statement that the tissue hypoxia exists when the cellular critical oxygen tensions are inadequate. This seems clinically appropriate since the importance of the presence of tissue hypoxia is that mechanisms other than oxidative ones must be utilized to provide metabolic energy. These anaerobic mechanisms are homostatically undesirable because one, they are far less efficient than aerobic pathways, and two, they produce metabolites other than carbon dioxide. Highest heart love, peace, peace, peace. Welcome, YouTube. Highest heart love. Disoxia. Thank you. Awesome. Peace, peace, Amen. Mia, Mia. Disoxia. Disoxia has been suggested as a term to characterize abnormal utilization of oxygen in the tissues. It appears to be a useful term because it encompasses not only tissue hypoxia, a reflection of altered oxygen transport, but also alterations in cellular oxygen utilization. Such abnormal tissue oxygen utilization in the presence of adequate cellular oxygen tension may be due to two factors. One, intrinsic mitochondrial malfunction, or two, hyperoxia. Discussion of the former is beyond the scope of this text and has no clinical application at present. The second factor, hyperoxia, is a critical importance to the respiratory care practitioner. Dysoxia related to hyperoxia is associated with four disorders secondary to erroneous application of techniques. One, depression of ventilatory stimulus in chronic hypercarbic patients who depend on peripheral chemoreceptors hypoxia. Two, use of capillary PO2 measurements as a guide for oxygen therapy in neonates. Three, adult blood exchange transfusion in neonates. And four, direct cellular toxicity. The lung appears more susceptible to direct cellular toxicity than other tissue. Let me read that again. This is very key. Thank you so much for reading books with us. Highest heart love. Wow. This is so much love and honor. Thank you. Oh, peace, Muhammad. I'll read that last part again. Wow. The lung appears more susceptible to direct cellular toxicity than other tissue. This pulmonary oxygen toxicity is discussed in the following chapter. Summary. Thank you so much. Peace, peace. Summary. Appropriate oxygenation depends upon adequate external respiration, oxygen blood transport, and internal respiration. Hypoxemia is the primary means by which we clinically assess oxygenation status. Various pathophysiologic causes of hypoxemia are responsive to different supportive techniques. True intrapulmonary shunting disease is supported by increasing cardiovascular function and reversing pulmonary pathology, e.g., bronchial hygiene therapy, PEEP therapy. However, a major therapeutic technique for supporting hypoxemia is oxygen therapy, which is discussed in the next chapter. Highest heart love. Thank you. Salute to you too. Thank you for being here and reading books with us. We just have completed chapter 6, Oxygenation of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. MCAT material, super high level. Masters are going to be mastering, right? Thank you so much. So when we pick up, beautiful thing about this, right? We pick up in chapter 7, oxygen therapy. Thank you for the likes and subs. We're pushing towards 500. This peaceful part of YouTube where we read books and learn from masters. I'm a master fitness trainer, so this work is very applicable to me, as well as healing the people. I had a wonderful year healing session today, yesterday. So happy Friday. Went over 400 breaths. We released pressure points. His arm started out here. By the end of the session, it was way down here. He could actually straighten it out in his fingers. A funny thing about this, right? When I go to stretch this tricep muscle and I'm stretching that because his left side, beautiful parrot, magic. His hand will start to open up because it's closed because he had a stroke, another stroke, and anyway, we're getting it back. It's a process, right? So when I go and stretch the tricep, his hand that's closed up literally just starts open. His fingers just start spreading out, and then he gets these little jerks where it does the same thing with his foot. When I'm stretching his foot, his hamstring, and I pull the toes all the way back, right? And we go to full extension on the hamstring. And then his toes will just bend and lock up. And then we release those pressure out, get it out, get it out, get it out. And it's all with based breathing to it, using the diaphragmatic breath. So it allows you to get deeper into the stretch, but also clear out the blockages. all important, it's all applicable, knowing thyself, and also what the main purpose and what I like to read these books for is so we can help others, heal others, right? Ourselves and heal the people. So thank you for reading books. This will be in the playlist as long as it's a good one because I go back. You'll see on this channel, I redo a lot of readings if they don't come out the way I like. And thank you so much for the likes and subs. Love you so much. Let's have a sip of love water. Cheers to completing another chapter. We just completed chapter 6, moving into chapter 7. Love to all our family and friends, all the ones that we've lost and elevated. We honor you with a libation to the self. Thank you. We love you. Mm, mm, mm. I love you. I love you. I love you. I love you. Thank you for breathing with me. Thank you. Gratitude for reading with me. Thank you. Thank you so much. Much love. I love you. I love you. You know it. I love myself. Thank you so much. That's why I come on here and do these readings. Because I want the best for us. That's what true love is. That's what I've learned in my life. True love wants the best for all of us. Thank you so much for the likes and subs. Thank you for sharing and, getting the word out. There's a peaceful place on YouTube where we read books, we uplift one another, show love. Thank you for being honorable in Bongi. Hi, it's Heart Love Danielle and Kevin. Salute. Peace, peace. I love you, Mom and Dad. I love you, Bubbles.